Hi, everyone. Thank you all so much for coming out tonight to this beautiful event. We're really excited that we had so many people who showed up. I'm sure just for our panel and not for Andy Cohen. But I am a board certified dermatologist. I work with Dr. David Shafer right down on Fifth Avenue at Shafer Clinic, Fifth Avenue. And I have the opportunity every day with our patients to dispel some of the myths that we're going to talk about tonight in this panel about, if you inject filler in your temple, does it migrate 6 years later over to your chin and things like that. And we are able to quickly talk to them about the science behind all of these myths and dispel it. And patients already have trust in us and they believe us, and then we move on when they may come in and say, I've heard something that I didn't like about filler, now I'm scared. So we can easily reach those who reach our chair. But we don't have the opportunity to reach those who may not come in because they've heard some of the misconceptions out there in the injectable space. And so we're really happy that Allergan has done the hyaluronic acid injectable report in order to really talk about the science and the truth behind what some of these myths that have been circulating have said. So tonight we're going to talk about some of these myths with our fabulous panel. We have Dr. Dan Belkin, Dr. Emily who just flew all the way from Oregon this morning, and my colleague, Dr. David Shafer. And Andy Cohen is going to help to moderate this panel and ask the tough questions. And what I want to call to action for all of you, since you do have a bigger voice than I do. I mean, I'm on social media and I'm helping to dispel myths in office and on social media, but y'all have a much bigger voice. Y'all can amplify the truth and dispel the misinformation and just recapture the claims that need to be made in the injectable space. So I hope that y'all will learn a lot and help to educate your followers accordingly. So thanks for coming.
Hey, everybody. How you doing? Great to see you all. Join me, doctors. Give it up for the doctors. Have a seat. Welcome to Naturally You. I've hosted my fair share of reunions, and I've seen my fair share of fillers, by the way, up close. Some great, some, leaving me questioning things. Tonight, we are talking to aesthetic experts, and I'm not going to take it easy on them. Raise your hand in this room if you have fillers. All right. Okay, very good. Wow, the two gentlemen.
Did you? Yeah.
Yes.
Good.
Okay, well, we are here to talk about injectable hyaluronic acid fillers, right? We've seen our fair share of conversation on this topic on social feeds. I've seen and heard it all, but this event tonight is about resetting the tone around hyaluronic acid fillers and celebrating what makes the field so unique: science, innovation, and natural results. We have a great panel of experts with us. These are leaders who are shaping the future of aesthetics every day, and they're going to help us separate facts from fiction. This is really good information. You will walk away tonight, I hope, better educated, empowered, and confident when it comes to making choices, especially around the importance of finding the right injector and the right approach to your individual needs. So first of all, can you each just introduce yourself and tell me where you're based?
Sure. I'm Dr. David Shafer. I'm based here in New York City. I practice with Dr. Engelman, and we're at 44th and 5th Avenue at Shafer Clinic.
Okay, specific. Do you take insurance?
No insurance.
Okay.
Hi, Dr. Emily Dendy said earlier, I just flew in from Portland, Oregon. I'm a plastic surgeon there, and I specialize in surgical breast and body and a lot of non-surgical face.
A lot of non-surgical face. Okay. That's interesting because I always, I've been hearing about liquid facelifts.
Absolutely.
A lot. Okay.
Hi,
Yes.
guys. I'm Dr. Dan Belkin. I am a dermatologist, and I work in New York in the Flatiron District.
Okay, so let's start with kind of the elephant in the room because I feel like fillers have, I feel like people, first of all, don't understand them, and I feel like they have a little bit of a bad rap. So why is that? Why do fillers have a bad rap?
I think fillers have a bad rap because you only see the bad results and hear about them in the news. The vast majority of people actually look very good. If 5 million people are getting injections and they look crazy, we'd hear more about it. So it's really those outliers that we're seeing.
Are fillers being unfairly blamed for what's really a problem of like poor technique or perception drift or unrealistic expectations?
If it's anything was in the media, people would say, oh, that person's had bad plastic surgery. So plastic surgery had a bad rap. Now the new hot word is bad filler. So people are just, I think, calling out that they're seeing something that strikes them as strange and just kind of weird looking. And right now we're just calling that filler, but I think it is unfairly being,
But I mean,
singled
sometimes
out.
it is filler.
Yeah.
For sure, and I think filler is a tool, and what I tell my patients all the time is that filler is just a tool. So you can use it for good, you could use it for evil, you could use it however you use it. So there are places, with poorly qualified injectors who do overuse filler.
Anyone want to give me an on-the-spot diagnosis for what fillers could do with my face?
But when you're looking at the face, when fillers first came out,
Oh.
a patient would come in and say, I don't like this line, let's fill it up. And then they'd look
Right.
like this, right?
Right.
And the shift has changed now. We have to look at the face as a whole.
It's really what's showing in your clothing. And so that's where it's really been exciting recently with some new developments in our toolbox to be able to globally address a face.
I want to get into some of the biggest misconceptions about injectable HA fillers. Which myth around injectable HA fillers frustrates you the most, and why do you think it persists?
I hear a lot of people worry that once they start, they have to keep going forever.
Okay.
And what I tell them is that it's better to have done it once and stopped than never to have done it at all.
Yeah, what I usually tell my patient is, look, by the time you're coming in, you've lost enough volume that you're net negative, you're seeing it. And so I have to put in enough to make a difference so you feel like something's happened.
Is there such a thing as perfect filler face? I mean, or is the pursuit of perfection exactly what leads to unnatural looking results?
Well, maybe it's in the eye of the beholder, but
Right.
but everybody's different. And so that's where the conversation that we have with patients is very important. I'll talk to them and I'll say, what do you like best about your face? And they might say, well, I really love my eyes, but they're starting to look tired. Or I really love my neck, but now I have to wear a turtleneck because I don't like my jowls. And then we talk about treatments we could do, whether it's filler or surgery or laser.
Fillers are often seen as medical, but I mean, it feels like they're also about artistry in a way. How do you describe the art of what you do? I mean,
Well, it is an art and a science, and the tool analogy I think was great. And when fillers first came out, there were only a couple different types of fillers, like a thick one and a thin one. Now we have a whole array. So it's almost like you're painting a painting and you only had 2 colors, and now you're painting a painting and you have all these different colors. So you can really be artistic and use your skill. And people can either be technicians, where they're just kind of injecting, or they can be artistic and combine their knowledge of the anatomy, the discussion with the patient and everything, and have a really nice result for the patient.
Yeah, from a plastic surgery standpoint, in the end, we want really nice outcomes surgically for our patient. We're not necessarily talking about what sutures we're using, right? That's the product we're using to get to that outcome. And so, in a sense, I would say in my hands, the filler is the product I'm using, but I'm using beyond that, my eye, my hand, my experience. So the product is the one that I choose, that I feel like I get certain results from, that are reliable in my hands. And that's different for different providers. People just want to be happy when they look in the mirror. That is not a, Miami or New York or California thing. We just want to be happy when we look in the mirror and feel confident when we walk out the door.
Right. But I think if everyone around you has huge cheeks, huge lips, you're going to feel like that's, there is that drift.
Yeah, it's setting the norm.
Yeah.
And one of the things I've learned after doing this for 20 years is we have to be able to say no to patients. So if a patient comes in and they want something that looks unnatural or it's not safe, it's okay for us to tell them no. Because if you go somewhere where they're not telling you no, that's where you kind of lose that natural look.
Yeah. Do they hurt? Does it hurt to get
I think so.
Yeah.
I mean, you're going through the skin. The skin's
Yeah.
got hurt.
Yes.
But they have numbing
have numbing
medication
medicine.
built into
Right.
them. They
They
you know, yeah. The technique you're using to put it in can affect how it feels. But it is a treatment. It is a medical treatment, like you were saying. It's not just getting a facial or that.
That's
kind of
another
thing.
misconception that I really don't like, is that it's easy to do, sufficiently, I guess, but it's
Right.
very difficult to do expertly and tastefully and well. And even having done a cosmetic fellowship and doing this for 10 years, I still have to talk to colleagues about best techniques and
Still
safest
learning,
techniques,
yeah.
and still learning.
Still learning from
And-
our own results.
Right, and I think people see it as like this very frivolous, easy thing, and it's not. It's hard to get really nice results, I think.
We could all paint a picture of something, but can we all paint a masterpiece?
No.
I've been seeing more and more posts about how fillers can actually age you and make you look older. Is this a problem with the product or a problem with the technique? Would seem to be a doctor problem, right?
Provider.
I think it's the
Provider,
the
yes.
technique you're using, and it's not just where you're putting it, but how deep you're putting it. And there's structural fillers, there's smoothing fillers, and we've all seen the people that are overfilled because they want to look smooth, but their faces look heavy, and that's because they're putting it too superficial in the wrong plane of the face. And that's where the knowledge of the anatomy is very important for it.
Okay, real talk. Are fillers actually unsafe, or is that a crazy misconception on social media? I mean,
There's risk with everything.
Oh, okay.
Right? Yeah. You were about to say that.
No,
too,
they're
yeah.
not. They're not unsafe, but there's
Right.
risks.
There's risks with
Yeah.
anything, but there's pros and cons with anything, and that's why we have to take precautions with cleansing the skin. There's risk of infection. You're breaking
Right,
the skin
okay.
barrier. But the product itself is not unsafe if done, in an appropriate way, appropriate planes.
Right.
okay, so I've read things online about how they can migrate and over time will move around and can make you look weird, frankly. Talk to me about that. I mean, is that a real concern, or how do you prevent that?
I think of that more as a technique issue.
Okay.
And using too much. So I think, there are kind of like these before and afters on Instagram where you see like this before and after that's spectacular, and it looks like they've had a facelift and they've used 15 syringes. I think filler is for volume. So if you're trying to use filler for things other than volume, I think you can start getting into uncanny territory where you're saying, okay, let's try to lift you by putting more in your cheeks when you don't really need more in your cheeks, but you're trying to lift the jowls by putting more in the cheeks. I think then you can get to a point where you're then overfilled in that area. So I think you just have to, for me, I just have to remember, like, I'm using this for volume. If you need volume in that area, then.
What would you say is the greatest benefit of HA fillers? I mean, like that could really, help.
Avoiding surgery. I
Yeah.
have so many patients who are just so happy that they don't have to consider surgery just yet.
But even with surgery, I mean, I'm a dermatologist, but post facelift, like I still have to volumize people.
Yep.
Yeah.
It's when you need volume. Like there's nothing. I mean, there are other types of fillers, but HA fillers are have the most variety in terms of texture. So if you want to be artful, you can use you use a whole variety of textures, and it's reversible should there be a complication, which I think is an important part of HA.
Dr. Shafer and Dr. Who, as plastic surgeons, talk to me about the perception that if you get fillers, it will make it actually harder to get a facelift in the future.
Yeah, I'm convinced that it's people who only do facelifts and don't do fillers who don't know much about it
Right.
who are saying that, so the people will jump right to facelift. But
Okay.
50% of my practice is injecting and 50% is doing surgery. So I do facelifts on people who had fillers for years and years, and they do just fine. So I think it's more of a marketing thing than a true concern.
Again, these things are not new to us. We operate on people who've had breast implant surgery multiple times. We've operated on people who've done something to their belly before we do the tummy tuck. So certainly if we are operating in virgin tissue, it's easier. If there's tissue that's already had something done to it, again, it's based on knowledge, experience, anatomy.
So if someone gets HA fillers with you, you're saying you can get a facelift after you have fillers, but once you've had a facelift, you will no longer need filler?
Yeah, a large part of my practice is patients who've already had a facelift, but now they're older, they have medical illnesses, or they're on blood thinners. They're no longer a candidate for additional surgery, but they're still aging. The nice thing that the facelift has done is it's kind of set things in place so there's less sag, but it doesn't mean there's less volume loss here, less volume loss here, less volume loss here. And so that's wonderful now that we can offer them something that doesn't require surgery again.
Talk to me about common side effects that a person may experience after treatment with fillers.
Swelling,
Swelling,
bruising,
soreness.
Yeah. And so I do try to educate my patients and set their expectations. I'm trying to give a surgical result without anesthesia, without scarring, but you're still going to go through the downtime and recovery because I'm treating this whole area. The body's very smart. It knows something's happened to it and it needs to recover. So you have to give your body some grace and give yourself time.
So, by the way, what's your breakdown of men versus women coming in to get filler? Is it split down the middle, or?
I mean, New York's going to be different. The bigger cities are going to be different.
Yeah.
I'd say probably 80% women, 20% men. But more and more men are doing it.
Yeah.
And men might start out smaller, but then they come back and do more.
Yes.
Yeah.
You guys have about the same?
Yeah.
Yeah.
Yeah, I find my men, they have really reasonable expectations. They just, want to feel like they're still, in the game, be it at work, be it in social circles.
Yeah.
Again, it's a confidence and feel thing.
So looking ahead, if you could rewrite the filler narrative for the next decade, what would you want to see?
I think the more tools we have, so more sophisticated fillers. It used to just be the shotgun approach, and I think now that we have more types of fillers and more different qualities of the different fillers, to being able to do a more sophisticated injection and then combining it with energy-based treatment, surgery, all of that I think is going to give our patients much better results than they have been getting over the last couple decades.
Right.
For me, what I've learned in this whole experience recently is that I think it would be really nice if we could have some regulation and standardization of training in this space, because I think, fortunately, in the medical space, it's a pretty streamlined and regulated and standardized training. So we know that when someone comes out to be a dermatologist or a plastic surgeon, they've had steps of training, oversight with the proctoring of doing things, the testing, all the things. And so we know what it means to be a board certified physician doing certain things. And I think right now with the injector world, we just don't know. There's no standardization of expectations for them as a provider or for the patient coming to them. So I feel like the industry is starting to recognize that, and I really applaud companies, spending money for brick and mortar training centers to try to kind of level it up and standardize training so the consumer knows what to expect when they go someplace.
Right, and I appreciate that Allergan had board certified dermatologists and plastic surgeons. Like there's certain fields that are the core aesthetics fields, which are derm, plastics, oculoplastics, and facial
ENT,
plastics.
yeah.
And anyone else, you don't know if they've had the same consistent training. So they might be good, but you just don't know.
And they could be passionate about it too. But
And there's red flags for consumers. So if the price is too good, that or much less than other places, or if they're promising so much it seems too good to be true, it probably is. In general, I like to undersell and over-deliver, and you might have these med spas saying that they can provide this for this certain amount of
and
money.
anyone can start a business and call it an aesthetic institute or aesthetic academy, and then someone can take a weekend course and get a certificate.
Right.
And it's just a little too easy right now to get into the space as to be an injector.
So what excites you most about the future of HA injectable fillers? Are we seeing advances that could change how dermal fillers are used in the next 5 to 10 years?
Yeah, I mean, like Dr. Engel said, that it's just a lot of technology changes in types of filler and structure, smoothness, just changes where we can apply it.
What is your hope for how the next generation of providers will approach dermal filler treatments?
I hope they look at it as an art rather than just a technique, and they really examine the patient as a whole instead of just pinpoint filler here, filler there, and not look at it just like I'm selling a certain number of syringes to make a certain amount of money, but making a nice result for the patient, and then they're going to be your patient for going forward.
I think it's both. It's art, but it's also technical, and you have to have respect for both. And part of the technical is knowing how to recognize complications, making sure it's safe. That's lacking in some places where it's seen purely as art. I think it's just it's you have to be respectful of both.
The underlying science plus the art.
Right.
It is lovely, though, as a provider, to be able to have an ongoing relationship with my clients and see them every 3 to 6 months. I think traditionally in the surgical world, you operated, you got them healed, and then they moved on. And so it's been a wonderful part of my practice.
Mm-hmm. You will now give me fillers on the stage. Right? Is that how we're going to end this?
Where are we injecting them?
You tell me. I mean, I'm sold. I'm like ready to make an appointment. Thank you all so much. This has been really interesting, and I've learned a lot. I hope you have too. A lot of misconceptions debunked, and this is exciting. This is really exciting. Give it up one more time for these guys, and thank you so much for paying attention and being involved. Thanks. And thanks, Dorinda.
You can stay. I mean, it's hard to do anything with you on the stage. You're the moderator. Hi, I'm Nicole Katz. I'm here from Allergan Aesthetics, and I just wanted to say thank you all for coming out. We promised a tell-all about HA injectable filler, and hopefully you would agree, we delivered. So I just want to say a huge, huge thank you to all of the wonderful people who joined us today. Dr. Dendy Engelman, we have Dr. Shafer here, Dr. Hu, Dr. Belkin, and of course, the man of the hour. Thank you for making it so much fun, Andy Cohen. Please stay, have drinks, mingle. Everyone will be here for a bit to answer your questions. And Dorinda, thank you so much for your surprise appearance. We're thrilled to have you. Thank you, everyone.